By training, I'm a pathologist whose job is actually to help physicians to make a diagnosis of various diseases. My area of interest is brain disorders, including Parkinson's disease. I think during my training, one of my best friend's dad suffered from Parkinson's disease, which sort of solidified my research focus on discovering biomarkers for Parkinson's disease. So the fundamental goals of our research, which is discovering biomarkers, is try to identify biochemical markers of molecules that can diagnose disease early, track disease progression, and hopefully objectively assess the treatment effects of various the existing and future medications. Right. So there are quite a few ways for us to help other investigators. Probably two major areas. Number one is we have been in the field for many years. We have accumulated tons in preliminary data, and we saw so-called candidate biomarkers. By offering exchange and sharing this data with the community, I think will really help them to develop their program faster. This is one way. The other, way of contributing to the community, I think, has a lot to do with the platform that NIND is establishing. That is, bring all the group together on the same table, right? Now, our technology to be used not only, I would call, state of the art, but also overlap with many used by others. So, but we're using different body fluids. So by exchanging data again, will dramatically facilitate the biomarker discovery. Those are two major areas I think will help each other, significantly. Right. The two. That's what actually a biomarker is about. So right now the major problem for Parkinson's disease is when the diagnosis they're at a late stage. So you can use biomarkers, can get early diagnosis that can increase the treatment window significantly. And the earlier intervention is, the better off for the patient. That's number one. Number two, the molecular markers, the molecules that we're working on, when we identify them and correlate with disease progression, those markers become the novel targets for scientists to develop new medicines to halt disease progression. I think these are probably two major areas that we can help the patients directly. Right. Our research is heavily depending on patient samples. That include brain donation, collection of the cerebrospinal fluid in the blood, saliva, urine, you name it. Right. So our research can help greatly if we can increase the awareness of the patients and participation patients and their family members to donate their precious samples as a research material. I think that's where a person can help us as a team to search for the cure for Parkinson's disease.